remember there was a moment right before the C-section started that it was before he was in the operating room, and Leah was just holding my hands and looking at me straight in the eye. I remember thinking, I can do this.
Leah is one of our star nurses. She shows immense compassion and caring for all of her patients, and they all seem to remember her.
My patients, when they come back for their postpartum delivery, often mention her name and what a great experience they had. I know my day's always going to go well when Leah's taking care of my patients.
She brought joy to our pregnancy and to the delivery in ways that I don't think we would have been able to experience.
Growing up on a farm was really fun because I got to see horses have babies. Working in labor and delivery is just like even better than that.
The consistency of Leah's care and delight for life is amazing.
Absolute joy and excitement and laughs and giggles of parents meeting their baby for the first time.
I've worked with Leah for 3 years now, and she has been such a role model. She is a fantastic nurse.
I think she just brings great attitude to everybody on labor and delivery.
L&D nurses are there on a very special day of someone's life, but we're also there on the worst day where they've lost their baby and they need that support.
One of the worst parts of our jobs is taking care of stillbirths, where people come into labor and delivery usually happy and with their families and expecting good outcomes. They come in with the worst outcome.
Leah pioneered the Rachel's Gift program and got it approved for our hospital.
There's a lot of one-on-one nursing that's hard to do for everybody that has to deal with it. And Leah's perfect with this.
The memory box that the parents receive contain baby's footprints, a little memory card, bracelets for the baby.
So we take the box to the family, we talk to them about all of the things inside of it, and it helps them not only look out into the community for resources and help, but also to hold on to those memories.
Those days just require a lot of extra patience and encouragement and just sitting with your patients.
I've seen Leah sit with a patient during their time of need and really talk to them about everything that's going to happen and really give them strength that they need to get through this time.
You're still with the patient and their family on the day they get to meet their baby for the very first time.
And she has been there to sit with them and just listen to them while they cry.
Taking care of families that have lost a baby really impacts not only your day and the shift that you work and take care of those families, but your week and your life outside of work. You take that home with you and you think about those families and their difficulty when they leave the hospital as well. And there's always a part of you that will remember those families.
She's amazing at all things she does on labor and delivery, but she's particularly amazing at this.
Having a child can be just a scary moment.
She was able to kind of keep me calm. She was really approachable. She was able to explain things in a way that I understood them. Her calmness is really contagious.
Leah gives 110% all of the time.
I love labor and delivery because I have the best coworkers in the world.
A patient's written in and said that Leah should come in and help teach other nurses the art of nursing.
They always seem to remember Leah and the name Leah, and they send her notes and thank you cards.
She sees past just your easy answer, yeah, I'm doing okay.
She really, truly cares.
I would describe Leah as being very compassionate.
When I think about Leah, I think about confidence.
To me, Leah is a star.